Malaria Diagnosis and Treatment.
Hello everyone, we're the Malaria Diagnosis and Treatment Group.
First of all, malaria is a parasitic disease spread by mosquitoes that causes fever, weakness, and death. Our team will show the important parts of the diagnostic process and the different types of treatment. And we will also show essential elements of the diagnosis and barriers people might have to access treatment.
I'm Serena Wynn.
I'm Chloe McDaniel.
I'm Emma Lee.
I'm Ethan Smith.
I'm Asina Ol.
And I'm David Turner.
So first, we have diagnostic methods. And for laboratory diagnostic methods, we use microscopy. And so this requires trained personnel to look at blood under a microscope to spot malaria parasites. This can also produce false negatives, and the results can take hours or even days. It is extremely labor intensive, and not all hospitals have this test available. And then we have PCR tests. PCR tests are not used often because although they are more accurate, the results take far too long. And so often a microscopy test will be used or an RDT test will be used. It detects parasitic nucleic acids and can also detect different strains of malaria. And it uses molecular diagnosis. Both of these ways use very sophisticated equipment, so not all hospitals have them.
Okay, RDT test. RDTs are handheld devices that is a quicker way to see a patient have malaria. The results of the test can be obtained in 15 to 30 minutes, and they also don't need a lot of training to use them. RDTs are also important because primary and secondary hospitals sometimes don't have the microscopy test. Using RTDs doesn't mean that the microscopy test is not needed anymore. Some RDTs may not detect infections with the lower number of malaria parasites in the patient. So the negative results of the test still needs to be checked by the microscopy.
There are challenges and limitations for every single type of malaria testing. It may just be the research isn't there yet, and also a lot of it is the technology isn't there, and not only just Nigeria, but in many parts of Africa as well.
Accurate diagnosis is the method by which medical officials use their clinical reasoning and laboratory diagnosis to make a decision of what the patient's illness is. And this is especially important in malaria because malarial symptoms are very similar to symptoms of other diseases and infections. And this means that the overdiagnosement of malaria happens with patients who self-medicate and choose to stay at home, and also with medical officials who aren't aware of the specificities of malaria and just make the assumption that the disease the patient has is malaria. And inaccurate diagnosement leads to inaccurate treatment, and then this means that symptoms in the patient worsens instead of gets better, and that money and resources are wasted with the healthcare provider. So doctors need to use rapid diagnostic testing to confirm their clinical diagnosement, and they need to use microscopy testing to certify the rapid diagnostic test, as rapid diagnostic tests can often show false results if they're used incorrectly, or even if they are used correctly, they can still show false results.
So when it comes to seeking healthcare, patients can go to any hospital they want to, primary, secondary, and or tertiary. All of these hospitals can help the people fight malaria at any time because malaria is so common in Nigeria that everyone's equipped to handle it. So once you go to a hospital, the medical professionals will usually provide you with the antibiotics such as those you see up here, chloroquine, primaquine, and or artemether, lumefantrine. And all of these pills will help you fight the different types of malaria that parasites that are inside of your body. But the most important people that we believe need to get these medications are pregnant women, because these women are carrying a baby. And if they have malaria, then the baby will essentially have malaria as well. And once it is birthed, can either be a premature birth, and when it is birthed, it will lose a lot of weight and will be in an unhealthy state. So whenever someone has malaria, and within 24 hours of discovery, they need to go to a hospital immediately or else they could possibly die. And with pregnant women, it's even more important because there's 2 lives at risk with malaria.
Okay, for disease treatment, first the patient should always take a rapid or laboratory test to see if they have malaria. And then the 2 forms are not severe and complicated or severe and complicated. So for not severe, they should take an oral ACT. This can be done in the patient's home, in a primary healthcare center, or in secondary and tertiary healthcare institutions. And for severe and IV, participate with ACT follow-up is required. There are many factors that prevent patients from going to the hospital. For example, social factors like cultural norms, like women and children will wait to get treatment until their husband consents, which can take a long time or can be never. And another big problem is patients think that malaria is simple and that they can treat it themselves, so they won't go to the hospital. This is called self-medication. And then economic factors that contribute have to do with funding and resources. So for example, some patients can't afford treatment for malaria, and some doctors can't afford the resources to treat it. Other factors are lack of information, so patients might not be aware of the risks that can occur if they don't treat malaria, or they might not even know that they have malaria if they are asymptomatic or choosing to ignore it. It's very important to participate in the entire treatment plan and to finish the treatment even if a patient starts to see improvement, because if it goes untreated, it can be fatal. For example, if parasite-filled cells block blood vessels to the brain, this can cause cerebral malaria, which can cause brain swelling, brain damage, seizures, and comas. And accumulated fluid in the lungs can cause breathing issues. The kidneys can be damaged, same with the liver, and the spleen could be ruptured. Anemia could also occur with low blood sugar, which could cause comas or even death.
Our workshop teaches healthcare workers about accurate diagnosis and teaches the community about the importance of treatment.
And we chose adults in the community for our first target group because they are the people who have the ability to go get treatment, especially men, and we want to show them that treatment is worth going for. And then for healthcare workers, we wanted to show the problems with diagnosement, specifically false results, and healthcare workers are the only, and if we chose regular people in the community, this would only cause fear and panic, so we thought healthcare workers would be a more beneficial option. And the goal of our first activity was to show the benefits of treatment and how it's more beneficial in comparison to staying at home and not choosing to get treatment. And we would do this with a demonstration. In this demonstration, there would be 2 jars which would represent the patient's body, and in these 2 jars would be floatable plastic balls which would represent the malaria within the patient's body. And in one jar, the treatment would be poured in, or water in this case, and the balls would float to the top and be taken out of the jar, which would show how the patient that was treated with IV artesunate, in this case, was cured, and the jar with no water in it would have more balls put in, showing how when you don't get treatment, the malaria within your body grows and spreads even more. And at the end of this, the participants would be given a poster.
So as she said, this poster is mainly a story poster that we created to show the positive and negative effects of getting or not getting treatment for malaria. So as my partner already stated, malaria is very common in Nigeria, and it's sort of the common cold in Nigeria as it is to America. And in America, when we have a cold, we don't really go to the doctor for it. We solve it at home. We just stay at home. We don't do much about it. So that's how they treat malaria in Nigeria. So on the left side, it's left and negative. There's both the sick one who has malaria, but on the left side, the woman decides to go to the hospital and get treatment and medication for her sickness. But on the right side, we can see that the lady is getting worse and worse in her bed, and she's just sitting at home because she thinks she can get through it. But at the end, we see on the left's positive side that the woman who went to the hospital to go get treatment she's happy, she's healthy, she's out in the world. But the woman on the right in the negative zone is again still at home, and she's getting worse and worse and worse. So this is meant to show the people that Not to force them to get medication, but to show them what could happen if it go down a certain path.
Our second exercise is how to properly use an RDT when testing for malaria. So basically, we're going to have 2 healthcare professionals, and they are going to be speaking to a crowd of other healthcare professionals on how to properly administer an RDT test. So after the demonstration, step by step, make sure that everybody can see what is going on. We will be using cardboard cutouts of RDT tests, since using actual RDT tests would be very wasteful. And to also inform the healthcare professionals that false negatives can occur due to poor transport and storage conditions of the test or the blood. And then after it is over, brochures will be handed out, which basically summarizes everything done. And so this is like the paper cutout of the RDT test that they will be using.
This is the brochure we would hand them after the session is over. Basically, it just gives a recap of what they learned and why it's important that their patients are getting the correct treatment, and why not only is it just important for the patients, but for just the community as a whole. And also where they can refer a patient to get a microscopy test to make sure that they are just protecting everybody in the community. For the itemized budget, what we'll be spending our money on is the poster, the large jars, the water, the paper for the RDT handout, yellow and red food dye, plastic table tennis balls, a pack of 60, local fruit and drinks, and the informational brochures. And that total cost will be $362. And then the rest of the money we will use to fund rapid diagnostic tests for the public. These are all the resources we use to provide this information to share with you guys.